Speaking of Washington State, again, you have another issue involving some of the policies going on in King County.
Yeah, this one's pretty absurd. King County Metro bus drivers, especially, working the downtown core. I think most of our viewers at this point know we have a drug addiction crisis exploding on the streets, especially fentanyl. And it's a free for all. You have drug addicts, riding the buses day in day out. I mean, the running joke is that it's a mobile homeless shelter now. So they're doing fentanyl, heroin in open air, plain sight, and these secondhand fentanyl fumes are making the bus drivers sick. The bus drivers are going to their union, to the county complaining, but here's the kicker. The county health officials are saying that fentanyl smoke is not a problem. It's absolutely insane.
I mean, this is where I wonder where the data is coming from, because I think we know with secondhand smoke, in terms of cigarette smoke, that's been proven to cause damage to people, but proven to have long-lasting health effects. And as I recall, cigarette smoke, 50, 75 years ago, they said there was no issue with cigarettes, right? It wasn't going to
Exactly.
affect people's health.
Yeah, and exactly, because there's a lobby behind it. And look, at the end of the day, I don't know who these doctors are. I'm not going to call him a quack, but I'm reading from Dr. Scott Phillips. He's the medical director of the Washington Poison Center, and he says exposure to smoke from fentanyl presents, quote, no real risk. He goes on to say when someone smokes fentanyl, most of the drug has been filtered out by the user before there is secondhand smoke. It doesn't just sort of float around. There's no real risk to the everyday person being exposed to secondhand opioid smoke. I don't believe that. Second of all, doctor, would you want to be around fentanyl smokers sitting in a bus? I challenge this doctor to sit in a King County Metro bus next to fentanyl smokers. I think if it comes down to that, I think he'd be singing a different tune.
I mean, most of us are trying to avoid this kind of scenario. So I mean, you're honestly in the middle of it. I've seen you out there with a N95 mask on. I mean, what when you're wearing a mask and you're 2 feet from someone consuming this substance, what are you consuming? What are you smelling?
Yeah, that's a great question. I think some folks who see my videos online, I post it with, the two shot, and people are like, why are you still wearing a mask? I mean, obviously, masks are associated with, COVID and so on and so forth, and the anti maskers, blah, 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 blah. I wear the mask on the streets when I go to downtown Seattle because, number one, I don't want to be recognized by Antifa, these far left activists who continue to target me. At this point, they all know who I am. But, like you said, the main reason is I don't want to be breathing in the fentanyl fumes. I'm around this every single day. Go to downtown Seattle right now, 3rd and Pine, 3rd and Pike, the main tourist corridor. You're going to see people doing all kinds of drugs in plain sight. They don't care. They're just looking for their high. And you just see these poor people, the folks trying to get on the bus, get to work, get home, just dodging like the gauntlet of addicts who are just, again, throwing needles on the ground, foil on the ground. I mean, it's everywhere. It's like leaves on the ground of just fentanyl foil. It's out of control. So these public officials, I mean, at the end of the day, they're sounding just like academics. They need to come out here to the front lines to see what it's really like, and I think they'd have a different perspective.
Yeah, I'm surprised to hear this, and I don't know if this is something that's specific to King County or have other health directors deduced that there's no issue with secondhand smoke when it comes to fentanyl.
Yeah, I mean, look, I haven't looked into the science, quite frankly, myself. I'm not going to say I'm a doctor, but at the end of the day, I'm going to err on the side of caution and avoid fentanyl smoke at all costs. I think it's problematic. What do you think? Are you going to be around a fentanyl smoker? You want us to take
Look,
that in?
look.
You want
I
to
mean,
take that around your kids?
I covered a chemical fire, maybe 15 years ago in Salinas, and you want to be some heroic reporter, get the shot of the flames, get the shot of the building going down. You got within 50 feet of that building, and you could feel the chemicals entering your system. And I was like, let's get the heck out of here. It's not worth it. And so that these were, that was a chemical fire. I just, these are chemicals. These are processed materials. I'm still stunned that people are so cavalier with their health, because you damage your lungs. You're not getting that back. It's really hard to fix damaged lungs. I don't know where these folks are getting data. Maybe they're not using data, and maybe that's the issue.
Yeah, and I've broke a story on this show several weeks ago about the fentanyl in the walls of these motels being purchased by King County to house the homeless. They're in many cases total losses. So if the fentanyl in the walls, prevent, an entire facility to be used. What about fentanyl smoke all adding up? Isn't it kind of the same source? I mean, again, I'm not a science major or a doctor, but to me, I'm gonna, use common sense here and say fentanyl smoke is bad. Avoid it. It's harmful.
Well, I think it's solid advice there. I wouldn't advise anyone to be hanging out in those corridors.